Okay, I think everyone should have the ability to record now. If I missed anyone, let me know. I'm Marissa Armstrong. I'm with Clark County Public Health. We have some folks on to talk with you all about the cases that have been identified at PeaceHealth. So we'll have Dr. Neville start, and then Dr. Melnick will follow up, and then finally, Catherine Cole, also PeaceHealth, will have a few comments. After that, we'll do, there'll be opportunities for you guys to ask questions. I'm gonna ask if we could have everyone use the hand raise feature since there's so many people, so we can make sure no one's talking over each other. So we will go ahead and start with Dr. Neville.
Thank you, Marissa, and good morning, everybody. So I am Dr. Lawrence Neville. I serve as the Chief Medical Officer and the Patient Safety Officer for PeaceHealth Southwest here in Vancouver, Washington. And really honored, along with my colleagues, to have a little time with you this morning to update you on the exposures at our hospital. I'm going to talk about three main things, and then I'm going to turn it over to Dr. Melnick, and then subsequently to Catherine Kroll for further elaboration. And then, as Marissa mentioned, delighted to take questions. So three main things I want to talk about. The first is the situation on the ground, what we're experiencing.
So the restaurant or the grocery store is about to throw it away, you can.
Then I want to talk just a little bit about our priorities going forward, and then some of the immediate steps that we have taken already to investigate and deal with the situation and keep our patients and caregivers safe. So in terms of the situation, we are a 450-bed hospital. We have been taking care of proudly of our COVID patients in the community since the start of the pandemic. We have taken care of over 1,000 of those patients.
Stadiums they built to run the races
year to date, and really, again, proud to play that role for the community. As part of our ongoing surveillance, which means all our patients are tested for COVID when they come to us into the hospital, but we also test again on day 5 and every 7 days thereafter as an added safety measure that we instituted to take the best care of our patients possible. We did on July 10th become aware of a patient that had turned positive and subsequently were able to detect more patients who also became positive for COVID. So let me give you some of the numbers around that. So currently we have 10 patients in total in a part of our medical ward on the second floor of our Mother Joseph building. So again, these are medical patients, and these 10 patients have links to that ward. We also, as part of our investigation, were rapidly able to find out that 4 healthcare workers also were positive for COVID. Some interesting things about these patients and caregivers are that the ones that are vaccinated, which are 5 of those total, of those 14, are completely asymptomatic. In other words, we detected them as being positive for COVID by the test, but they aren't showing any COVID-like symptoms. So I really want to underline that because it really, again, shows how effective vaccines are. You may still have a small chance of getting COVID, but your chance of getting severe COVID or even symptomatic COVID is dramatically reduced. So that is in a high level, the situation on the ground currently. Talking and switching to our priorities is always patient safety and the safety of our caregivers. So we have done a number of things in sort of rapid succession to increase what we're already doing to make sure that while we look into the situation, everyone remains safe. So among those action items, switching to my third point, we continue to use our standard use of masking and eye protection and other things that we use in healthcare to keep everybody safe. We did stop temporarily all visitors to the hospital except in certain unique situations. And we did that over the weekend. And that's just to keep everyone safe. And we've known from some of the past experiences that occasionally an unvaccinated visitor can come in the hospital and potentially have COVID and be not showing symptoms, but be in the contagious period. So as an extra measure, we're doing that. And I know that's hard on everybody and certainly hard on our patients, but we really need to keep them safe. The other thing that we've done is we immediately stopped new admissions to that ward, and we tested each and every patient on that ward and the adjacent ward to make sure that we weren't missing anybody. And we're able to get the results of that and act upon them very quickly. And in the meantime, as we do all those sort of immediate measures to keep everyone safe, our awesome infection prevention team is working with Clark County Public Health to try to get to the bottom of what started this, who or what we think precipitated the infections, and make sure that we've got to the bottom of that so we can get back to normal operation and prevent this from happening ever again. And with that, Marissa and others, I'm going to turn it over to Dr. Melnick to speak a little bit about Clark County Public Health and their view of this topic. And again, thank them for their partnership as they've helped us really respond to this.
Thank you, Dr. Neville. For the record, Dr. Alan Melnick, I'm the Public Health Director and Health Officer for Clark County. We're working really closely. Appreciate the work with PeaceHealth on the investigation. This situation is another reminder that COVID-19, the COVID-19 pandemic is not over. It's not done with us yet. Nationally, you already are aware that case numbers are increasing, and we're now faced with the Delta variant, which is more transmissible than previous versions of the virus. And the last situation or report I saw with the state of Washington is that the Delta variant is responsible for over 41% of the cases in the state right now. The best protection against COVID-19 is vaccination. Currently, 62% of Clark County residents 16 and older have initiated vaccination. They've had at least one dose, and 56% of Clark County residents 16 and older are fully vaccinated, which means they're 14 more days past their second dose of Moderna or Pfizer, or 14 days or more past their dose of Johnson & Johnson. We need to get those numbers up higher. You know, I'm concerned that vaccine demand is dropping. We definitely need to get those numbers higher. And this outbreak, again, points to the effectiveness of the vaccine. As Dr. Neville noted, the people who were fully vaccinated did not have symptoms. And I would also point out that people who are fully vaccinated have lower viral loads and are less likely to transmit infection than people who are not vaccinated. In terms of vaccine effectiveness, I want to also point out that the number of vaccine breakthrough cases, that is cases in people who are fully vaccinated, the rate of that in the state of Washington is 0.07%. That's 7 in every 10,000. So these vaccines are still highly protective. I'd also point out that the rate of severe disease, the hospital admission rate for COVID-19 in people who are unvaccinated between the ages of 45 to 64 is 16 times higher than the rate of hospitalization for people in that age group who are fully vaccinated. And people who are 65 and older, the rate of hospital admission for COVID-19 is 12 times greater in those who are unvaccinated compared to those who are fully vaccinated. So the vaccines work, it's the best protection. The pandemic is still with us, and we'll continue to work closely with PeaceHealth on this investigation. And I'll turn it over to Catherine Kroll, I believe.
Yes, Good morning. I'm Catherine Kroll. I'm the Director of Infection Prevention for the PeaceHealth system and am collaborating with Dr. Neville and with Dr. Melnick's teams to assure the investigation of this. In addition to all of the things that have been said, my team is heading up the investigation of how this might have happened. And so we are investigating the possible sources. There are 3 sources that could have happened here. The first is that a visitor could have brought this in and transmitted it to patients and healthcare workers in our facility. The second is that a patient could have come in from the community incubating the virus, so they did not test positive when they were admitted and subsequently became positive, and transmission occurred within the hospital that way. And the third is that a healthcare worker could have unknowingly come to work while positive and transmitted. And so we are investigating all 3 of those. Our immediate steps were to control the current outbreak and involve testing all of those who we thought could be exposed and are at high risk. And as you've noted, we have 10 patients and 4 healthcare workers who we have identified through that testing. Our next steps are to look at all of those visitors who've come in collaboration with public health, to notify patients who were discharged from the unit. All patients who we believe are at risk have been contacted. So if you're a patient out there and you're worried that you may have been exposed while you were here, unless you received a call from our hospital or from the public health department, we have no evidence that you were exposed, and we have every reason to believe that you were not while you were here. If that changes, we will of course update and continue to reach out to our patients so that you can know if you are at risk and if you should be continuing to watch for symptoms. And then, as Dr. Melnick noted, it's not too late to get vaccinated. If you've been on the fence, this outbreak really shows us that even if you can be infected while after vaccination, that the vaccination prevents you from developing severe disease. Thank you.
All right, I'm going to go through. If you have questions, please use the hand raise function and I will just call on folks. So Tim Gordon, go ahead.
Okay. I think I've got a couple questions. One, I just maybe is best for Dr. Neville, but I'm curious how sick, what are the symptoms of those who are sick, those unvaccinated patients? What's their level of illness? And then I'm also, from Dr. Melnick, I'd like to ask a question as well about something, but I'll start with that.
Thank you, Tim. Great question. So it's a range. So again, starting from the vaccinated patients, they seem to be completely asymptomatic from a COVID perspective. So that's really, really encouraging. The folks who were not vaccinated range from very, very mild symptoms that require minimal additional intervention to a few who are having more severe symptoms. We do not have anyone at this moment who's requiring ICU level care related to this, which again, we're really grateful for.
Okay, thank you very much. Can you say whether any of your 4 healthcare workers were unvaccinated?
Yes, I can. Thank you, Tim. We do not have mandatory vaccination policy at this time, just like most health systems do not. And we do, some of those healthcare workers were either unvaccinated or had not completed their vaccination. So they had started them but hadn't completed them yet. And then of course some indeed were, and the ones that were are the ones that seem to be very protected in terms of symptoms.
So I'm taking it that is it 2 and 2, or can you say two vaccinated, 2 completely vaccinated, or?
Yeah, so thank you. It's 2 unvaccinated and 1 in the process and 1 fully vaccinated.
Thank you so much. And I want to dominate, but Dr. Melnick, if you don't mind my asking you as well, you talk about the breakthrough case percentage is so low. Can you explain how we have 5 out of 14 in this case? That's higher than the average.
Yeah, well, this is just a small sample of what we see in the state. So with the numbers that small, if we were to test the entire population, we'd see a lot. We'd likely see a lot more infections, if we were to do screening in people who are unvaccinated. So the issue is really, statistically, it's a small sample size, and the point I want to make is, if we tested more, we might be able to find more. But the point about the vaccination, besides the low rate of breakthrough that we're seeing, is that people who are breakthrough cases generally are often not detected because they don't get sick, and we know that they don't transmit as well. So that's a bigger take-home point here.
Absolutely. Excellent. Thank you. And how soon will we know if this is a Delta variant? And then I'll be done.
So when we do these, not all cases, not all specimens are sequenced in the state of Washington. So the numbers I gave you about 40, the 41% number comes from, there's a random, I believe it's around 5% of all cases are randomly sampled for variants. And that's where we get the population numbers that we have. We know what percentage of cases across the state are due to variants. We also test specimens from outbreaks. The reason we test specimens from outbreaks is we're looking for not just the Delta variant, but we're looking for new variants as well that might be transmissible, especially if you have outbreaks with high attack rates, where lots of people get sick. We also test for variants when we're seeing somebody with a reinfection or somebody who's a vaccine breakthrough. So there's a variety of situations. I haven't even named all of them where we test for variants. So we're not just testing for Delta variant. We're looking for all variants when we have outbreaks like this.
Thank you.
Wayne Haverly.
Yeah, I actually just, I think Tim covered a lot there. I just wanted to follow up on a couple of things there. So finally on the Delta variant, are the patients at the hospital that part of this outbreak, are they being tested for the variant, for the Delta variant?
They are.
They're being tested for all they're having, we call, genomic sequencing being done. They're being tested for any potential variant, including something we might not have seen before.
And then this question's for Dr. Neville. Among the unvaccinated healthcare workers in the PeaceHealth system, do you have a percentage on how many of your healthcare workers have been vaccinated?
So I haven't looked at the figures in a few weeks. We have far more than the majority who have been vaccinated. We continue to encourage it strongly. We have ongoing campaigns to encourage it in various ways, but we are not yet at 100%.
Do you have any rough estimate on where you're at?
So we are roughly at 75%.
Thank you.
Thank you.
Katie Fairbanks.
Yes, hi. My question would just kind of be going off of that. Do outbreaks like this kind of go into consideration as to if PeaceHealth would require vaccination for healthcare workers, or, is there a certain point that you would get to when you would consider that? I don't know if that's kind of a question for the system as a whole, but.
Yeah, Katie, I can answer that. It's a great question. So certainly, our foremost mission, right, is to keep our patients safe and our caregivers safe. Having an exposure like this does make one pause. We already had a lot of energy around universal vaccination, and this is something that we'll be, at a system level, we'll be doing a lot of discernment around. At this point in time, there are not plans to vaccinate, to mandate vaccination for everybody, but there are some other plans that we think may mitigate further, lessen further the risk that those caregivers may pose to each other or their own safety or to patients. And unfortunately, I'm not in a place to discuss those yet, but we are actively, we've got teams thinking about what those additional strategies would be.
Thank you.
Were there any other questions?
Yes, please, as long as nobody else is asking. If I
Go for
could,
it,
just
Tim.
since Dr. Neville's up, can you just clarify for us the timeline again? It was July 10th that a patient tested positive for COVID, and you'd said, was this then their 5-day test, or can you just kind of run the timeline again for me so I understand it properly?
Yeah, thank you. So like I said, all our patients are tested automatically, whether or not they have symptoms on admission. And then we do additional testing while they stay with us as an added layer of protection. So the first patient who showed up with this additional test was on July 10th. And then the second one was the subsequent day we became aware of that patient on July 11th. And then as we moved into universal testing of patients on that ward, we were able to detect the subsequent patients.
Right, but and then so the initial patient, though, obviously it wasn't their admitting test because they wouldn't have gone to that floor or ward if they tested positive coming in. Correct?
That's right. So if you test positive coming in, you go to a COVID ward where you're kept with other COVID patients for your protection and the protection of others. So they tested negative on the initial test, and as Catherine spoke about, what we're trying to figure out now is things like you can test negative as you come in, right? If you're incubating the virus, but you don't yet have enough virus in you to test positive, or were they exposed to something from a visitor or a caregiver or a fellow patient while they were in the hospital? And those are still unanswered questions, but that's really the main emphasis now is to figure that out.
Okay, and thank you. And Ms. Kroll, just one other thing. Can you say how many people that were at risk that you've had to contact? How many people are part of that pool?
Yeah, for patients who were discharged, we've contacted 44 patients who were discharged. None of them have attested to having symptoms, and none of them have sought testing that we are aware of at this time. We will continue to monitor that over the next 2 weeks.
What's the likelihood at this point in time that they'll come up with symptoms? I mean, is there a point where it becomes, oh, it's past time for them to?
Yeah, if they are fully vaccinated, it's unlikely that they will come up with symptoms. And so that's part of our reason for contacting them, so that they can practice more cautiousness, even though they don't have symptoms. If they're unvaccinated, we're uncertain right now of the likelihood because we're better understanding what are the risk factors for having been potentially infected while on this floor. So we are encouraging those who are unvaccinated to have a very low threshold for getting testing, and we are providing that testing through our clinics at no cost to any of those patients, and we'll help arrange for transportation, et cetera, so that we assure that there are no barriers for those patients being tested. But again, we've notified all 44 of them. None of them have come down with symptoms at this point. Based on the early epidemiology, we've narrowed what we believe to be the potential exposure window down to a few days that we are concentrating on. And so 14 days out from that set of days would look like it would be late July. And so we will be feeling confident that if nobody tests positive in the next 10 days from that group, that we have identified and controlled from the exposure.
Thanks for taking all my questions. I appreciate it.
I've got a question if there's time. Can you explain why you don't currently require employees to be vaccinated against COVID-19?
Thank you, Amelia. That's a great question. So it has to do with a number of things. One, it has to do with our discernment about where we are as a country, which includes our healthcare providers, in terms of coming to a consensus around vaccinations. And just like out in the community, we have a diversity of healthcare workers with different opinions and different sources of information about vaccine safety. We also want to respect our relationship with individual caregivers, some of whom may have, medical conditions or something else that may preclude them from getting vaccinated. It's also the case that these are vaccines which are, we think, extremely safe. We think the medical community supports that, and there is not yet universal opinion behind that in all sectors of the society. So most healthcare systems across the country have followed us and not yet mandating it. But I will say this, and I'll say it really strongly. If a place as safe as PeaceHealth Southwest, with extraordinary experience taking care of COVID patients and an extraordinary public safety record, can have an outbreak like this, it really shows that we are all extremely vulnerable to COVID reemerging. And we're all tired of COVID, right? We want it to go away. We want to be able to stop wearing masks and stop social distancing, and I get that and very sympathetic to that. But this really is a wake-up call, I think, that if it can happen here, it can happen anywhere. And the energy around vaccination needs to increase even more than it already has. And if there is any silver lining to this story, it is that it again points to the fact that if you're vaccinated, you may still get rarely a extremely mild asymptomatic form of COVID, but you won't get severe disease. So please, if you're hearing this message out there, strongly consider getting vaccinated. There's still plenty of vaccine out there. Thank you.
I want to just make sure that I get the first part of that I understand what you're saying in the first part of that. You said you want to respect the sort of range of opinions that your providers and staff have on this issue. And what you're describing there is really a political divide over vaccines, not a medical debate, correct?
I think the medical community is really unanimous or nearly unanimous that vaccines are the way to go. I think what we've seen with COVID-19 is, unfortunately, the medical opinion on this hasn't always been the overriding one for everyone. And that's really unique and tragic in some ways in terms of the consequences. But we do really value our relationship with our caregivers, and we continue to engage in dialogue with them. And I will say that we will be putting measures into place to further reduce the risk should folks choose not to get vaccinated, to make it really unlikely that they can transmit anything to anyone else inadvertently, and to keep them safer. Thank you very much.
And I'm not trying to sort of denigrate the idea that you would want to take into consideration those kinds of beliefs and values, just trying to draw out that distinction. So thank you.
Thank you, Amaya.
Any other questions? Okay. Well, then we will go ahead and wrap this up here. Thanks everyone for joining us.
Thank you.
Thank you.
Thanks.